today. So the first case is a lady called Miss Lin. She's aged around 52 years old, and she came to clinic on the 2005 August on the 9th. The patient was diagnosed with rheumatoid arthritis at a hospital in Beijing. It would manifest as pain and stiffness in all joints. And it was particularly severe pain in the shoulders, elbows, wrists, and fingers. And there was a large reduction in ROM, or range of movement. So generally affecting kind of the upper half of the body. So some of her other symptoms is that she would sweat a lot, has a fear of wind, a dry mouth with a desire to drink, occasionally has tidal heat effusion, which we might, that's the kind of the Wiseman term, but we might commonly think of it as more like hot flushes. It's probably the more colloquial term. And then she'll like get this hot flush and suddenly start sweating. Very easily irritable, frequent urination, and like a hot kind of turbid odorous breath as well. So the tongue is red with a kind of greasy white coating or slimy white coating. Pulse is deep and string-like, thin, slippery, and rapid. So with Dr. Zhang's pulses, he generally just gives a little bit of an outline, and they're not too, how do you say, nuanced in his view. They're a little bit generic, I think, and that's okay. We kind of just can work with that. So obviously here you might think that, okay, there's a fair bit going on. What are we thinking about? The big thing is the joint pain, but then there's also a lot of heat as well, especially with like the tidal heat, the hot odorous breath, but then the interesting thing is that you have like a deep pulse with this. But I think the key with the deep pulse is that it's also rapid as well. So it's indicating a little bit of heat. Then with the tongue, you have that kind of redness and the greasy white coating as well, which is probably indicating dampness. So we could go like a very, very kind of complicated diagnosis, or you can do what Zhang does, and he just calls it damp heat impediment, which I think is like, it's not complicated at all, but it really gets down to just exactly what he wants to do, which I think is kind of brilliant as well. Sometimes, at least when I've been in a student clinic, people will try to come in with a very kind of complicated diagnosis and things like that. But from here, he's really just taking almost a disease approach diagnosis to treating this as well. So the formula that he uses is 炸健母方剂汤, okay? And the composition is Fenfangji 18, Guija 15, Shangsha 45, cooked or fried prior, Xingren 10 grams, Fei Huashe 30 grams, Tong Cao 6 grams, Shengyiren 30 grams, Zhang Huang 10 grams, Hai Tong Pi 10 grams, Zhimu 10 grams, Wu Xiaoshe 10 grams, Jingfang Tong 20 grams, and 7 packets of that. So a couple of herbs here that we might not be super familiar with is Hai Tong Pi, Wu Xiaoshe, and Qingfeng Tong. At least I wasn't very familiar with those, and I'm not sure how much you guys are. Maybe Ivan and Will have a little bit more experience. But with those herbs, I looked them up, and they are mostly all herbs that treat like kind of wind damp syndrome. If I have a look. For example, if I can find it, sorry, we went one far too far. Yeah, for example, like Qingfeng Tong will treat, wind damp, open the collateral, so it's going to really treat pain. Same has, where was it? Wu Xiaoshe, also, once again, that one will also treat kind of dampening, painful joints as well. So it's kind of taken a base formula and added a few extra herbs to try and treat the pain there. So I would say a couple of important things to look at this case is the dry mouth, the desire to drink, the tidal heat, vexation and easy irritability as well, and probably the frequent urination, and looking at the redness of the tongue, and looking at the deep slipperiness and rapidness of the pulse as well.
You said this doctor was influenced by Tianshi, correct?
Yeah.
Or wrote.
Well, he wrote a book on him, so I would say yeah.
Well, all those herbs like Hai Tong Pi, Wu Xiaoshe, Qingfeng Tang, are kind of aligned with Yet Tianshir's principles of kind of entering the law ladder, right?
Yeah.
Because Yet Tianshir is all about, disease entering the law, disease entering 8 extra level. I mean, we could even say that it's because of Yet Tianshir that so many people are obsessed about 8 extra vessels. To some degree, the idea of treating at that level is kind of Yet Tianshir's premises, especially in herbal medicine. So Wu Xiaoshi, is aligned also with Yet Tianshir's principle using these animal products to kind of scour like diseases that are deeply entrenched.
Yeah, cool. Well, yeah, look, I don't have much experience with these herbs, so thank you for sharing that, Ivan. I really, really appreciate that. But I honestly, yeah, I wouldn't, because I looked through them and they all seem like also relatively newer herbs, not really in the Shandong Bensao Jing. So
Mm.
that would make a lot of sense given his his past work on the Ye Tianshi book, that he would look at implementing these. So we'll have a look. And second consultation, so 1 week after, the aversion to cold is now gone. The joint pain is also significantly reduced, which has allowed for an increase in range of movement. However, the left pulse is now deep and sluggish. And he uses the term sluggish. I'm not really sure how to interpret that, but that was kind of the best translation of the character that he gave. Oh well, sorry, sluggish. Sorry, it was like stagnant, but I don't really know about having a stagnant pulse, so I thought sluggish was maybe the better translation of like, like jur. Um, pulse is right. Right pulse is deep, string-like, slippery, and rapid. He says now that
直 pulse, like with the three waters on the left side.
yeah, so like the same as like chi jur, right? Like stagnant chi, but he says the pulse is like stagnant or sluggish. I
Yeah.
wasn't really sure. I haven't seen too many pulses
I
described like
mean
that.
the like fire god school, they have that pulse and it's, I mean, typically it's like a wiry pulse.
That
And that actually also Chen Jianguo describes wiry pulse in that way as well. But I'm not sure if he's doing that.
that would probably make a better sense given that the previous pulse was also string like. Maybe it's
Mm,
just a varying degree. Like, it could possibly be more string like, something like that. I'm
yeah,
not
yeah.
entirely sure.
Mm.
The tongue now is bright red with a greasy, slimy, putrid yellow coat in the center. And he adds the previous prescriptions, adding Salgor 5 grams for 7 packets as well. I'm
Hmm.
not so familiar with Salgor. Either any of you guys?
It's just another damp,
Just another.
warming damp in the middle.
I'm mostly familiar in it in the context of malaria formulas, reach the membrane decoction that or drink Dayunyuan. It's like a core herb for
uh,
that. Kind of like really damp turbidity in the membranes.
so it's kind of like used in that warm disease kind of school for that kind of penetrating the membrane sort of thing.
Yeah.
Interesting. Um, so he
I think
comes.
I think it's also used for the Zhang disease that you catch in the
South,
tropics
yeah.
Like the
in the south,
miasma or
yeah.
something, like miasma, is it?
Miasma, yeah.
Yeah,
It
something
has
like
like
that. That kind of one from like the weird kind of odorous smells from like warm swamps or something like that.
Yeah, yeah.
yeah.
Yeah. So third consultation, the hot flushes or tidal heat and frequency of urination have also now reduced. There's currently no pain in the joints or muscles, and she is now able to independently wash herself and also has beginning to perform household chores as well. She still occasionally experiences fatigue and a whole body heaviness, and still some shoulder and knee pain, but only after doing kind of the chores. So she felt okay until she actually started using them and doing something.
Trying to
So
get out of the chores, it sounds like.
no,
No, I'm just kidding.
you gotta keep moving. Um, oh geez. So he gave the same formula, but we removed Wu Xiaoshi and Jingfang Tang, but he also added Renshen, and he gave 7 packets to them as well.
Hmm.
Do you guys, what do you think of the addition of Renshen?
I
Hmm.
can, I mean, I just think Well, because he takes out Wushasa and Jingfang Tang, which are more like moving herbs, pretty powerfully moving, penetrating into the collaterals.
Yeah.
But what those also can be pretty draining on upright chi. And then he's adding red Rensen. Now remember red
Oh, red
Rensen.
Sorry, I missed that. My apologies.
And remember with red Rensen, it's Rensen, but it's treated, right? Don't tell Corey, but it's treated in a special way. This is like this red Rensen. Typically, I mean, there's some in northeastern China, but mainly it comes from Korea, right?
Oh, really?
A lot comes from Korea, yeah. And it's red Rensen is typically treated with foods
Okay.
over a long period of time. You have you have like 5-year, 10-year, 15-year. And so it's much more supplementing. It's one of the most supplementing forms of Rensen.
So it's even kind of like yeah, really kind of quite warm and has like almost like kind of like a small essence of a bit of fuzu within it as well.
Yeah.
Yeah, kind of interesting.
I thought Red Renshin was from Korea was Gaoli Shen. It's
I
just
think
a
it's another
different
name
right?
for it. Yeah, it's just another name for it. Yeah.
One interesting thing though is that, and we'll talk about this a little bit later, is that Jiajian Mufengji Tang takes out Renshin, but Mufengji Cheng from the Jingui actually has Renshin in it. So,
Right. Yeah.
So that's another kind of like interesting idea of his modification. So 1 week after, so this has been nearly a month since she came in, the fourth consultation. No apparent joint pain. Same prescription was given for 7 packets. So subsequently, the patient visited weekly and alternated between Jiajian Mufengji Tang and Dangui Niantong Tang prescriptions until December, so approximately 3 to 4 months until the patient stabilized and they stopped taking all medications and they observed their condition. So it's yeah, quite an interesting case as well. And I think it's a good interesting idea as well of using that Jiajian Mufengji Tang as well. But personally, I would have liked to have seen it without the extra herbs, just to see it straight up, but that's okay. I always like to kind of just see, how does a formula work without the additions, and just see how maybe if it's working well, then, or maybe it doesn't work as well, then you add in those extra herbs and then just see whether or not that's enough to kind of push it over the line. But it would have been nice to see whether or not they just could have done it without that as well. All right, we'll move on to, do you guys have anything to talk about this case? Otherwise, we can kind of like talk about both the cases at the end of the other case.
I think I'm wrong. I think it is from Korea, but I think it's the Gaoli-shan is the one that has fuzhi.
Sure.
Sometimes I don't know, it's a bit confusing. Sometimes it's also called Gaoli-rensen. Maybe we can add in the comments.
Yeah. I haven't looked that up, so I'm not sure at all. And we might not be able to get a definitive answer as well. It might just be, it could be this, it could be that. All right.